Good morning. Good morning. Friday. Fry-yay. Finally. How's everyone doing out there? Have you had a good week? I have had numerous requests for this topic today, so hopefully those of you that have been requesting it can join in. I want to talk, and I'm sorry guys, but I know there might be some ladies in your life, so this topic might be good to you as well. I want to talk menopause. I want to talk hormones. You know, this isn't an old lady's disease, right? I think when I was writing the article on menopause, I remember looking for a graphic, right, for the top of the article. And I would type in the graphic search menopause or hormones or whatever. And all I would get was like pictures of 80-year-old women. And I thought, wait a minute, like I'm 44 years old. I have friends that have gone through menopause. I have friends that are going through menopause. I have friends in their 50s that are going through menopause. And they're young, vibrant, hardworking, busy women. They're not retired, you know. And I mean, a lot of these pictures were like, I mean, I'm not kidding, like people who are definitely at more towards the end of their life. And I think there's this assumption that menopause comes with old age, and really it doesn't. It comes with just age. And as women, we're doing more and more and more every single day. We're younger, we're healthier, we're living longer. And now menopause is something that we do midlife, not end of life, right? And so I think it's a great thing to talk about because a lot of the therapies that are still out there are very old school, and they're not looking at the current woman, like what the current woman is going through, and also the way that stress impacts our hormones. Unfortunately, our menopause symptoms are getting a bit worse because we're allowing stress and lifestyle to impact them. So I hope this is going to be a topic that you guys are going to enjoy. And I'm not just going to be talking about old women here. I'm talking about women simply like me. You know, we're not, this isn't something, yours started at 47, right? And you weren't, you know, I mean, I look at some of these pictures, and even when you go on to like, if you Google search, you know, symptoms of menopause or going through menopause, it's all pictures of very elderly women. And granted, all of these women have gone through menopause, but they didn't go through it when they were 80. Most likely, they went through it when they were in their 50s. You know, I mean, the most average age, I think the most common age for menopause to start is somewhere between 45 and 55. We're young, man. I'm not ready to be retired at 55 years old. So let's talk about it. Let's talk about the symptoms of menopause, the real symptoms of menopause. Let's talk about the individuality of women, how we're all different, how we all have a different menopause, and how we treat these differently. That's what I want to talk about today. So hopefully you guys are on board. Men, man, bear with me. I'll still try to make it fun, entertaining, and hopefully helpful to you when dealing with loved ones around you that might be going through this, okay? So it is Friday, October 9th. I am Dr. Tricia Pingle. This is your morning checkup. Yay, it is Friday. I cannot wait for the weekend. I'd like to go do some fun things. I saw a friend last night, had dinner with her, and I hadn't seen her in a while. And if she's watching, so nice to see you. So nice to get out there and collaborate, right? And chat with women about things we're going through. You know, so yeah, I see some comments, or earlier, right. Do hot flashes and overheating at night last years after menopause onset? I don't know whether it's the foam mattress or me. I'm 69. Yeah, well, let's talk about it. Let's see. Let's talk about all the different things that can happen, because it's not as straightforward as, all your hormones, you don't wake up and all your hormones have just dropped. That's not the way it happens for most women, right? Most women, this is going on for a long period of time, and it's a lot of varying degrees and different symptoms over the course of those times, right? And we treat them all the same. I have a dear friend that I respect greatly that went through menopause early and ran into the same frustration, and she was kind enough to share stories with me about being a younger woman, being in her 40s and going to a doctor and having these symptoms and lab results showing menopause, and how there was really no option for her. It was basically, here's your script for an antidepressant, go see a therapist, here's some calcium and some estrogen. without much discussion or understanding that maybe hers was a little bit earlier and she may have a different presentation than someone else. And I want to thank her for taking the time to share her story. She will remain unnamed. But, when I hear stories like that as a woman and as a doctor, it frustrates me because you could have a woman who's 41 going through menopause, or you could have a woman that's 71 going through menopause. And there's a lot that changes in those years. I mean, that's a 30-year span where menopause onset could happen at any time. And so to treat all the same, it just doesn't seem logical to me, right? Does it to you guys? Have you had this experience? Have any of you out there been going through these symptoms and you go to your doctor and it's just like this blanket, here's a script pad, we're not going to talk about how crazy you feel? I mean, I've been pregnant twice, and I can tell you, hormones make you feel crazy. Drops of hormones make you feel crazy. And I had normal, healthy, wonderful pregnancies, but man, I mean, it makes you feel like you're kind of off your rocker. And I think to go into a doctor and try to express that and be vulnerable and be like, hey, I'm really not feeling great. I feel stressed out. I feel anxious. I feel depressed. And have the doctor be like, all right, well, here's your antidepressant and here's a therapist you can visit, is kind of discounting, right? Makes me mad. Makes me mad too, Carolyn. I'm with ya, right? So let's talk about this. Going through menopause at any age is a very scary, life-changing event. Not only does it have a psychological aspect to it, but it also has a physical aspect to it, right? And I wasn't even given estrogen, no help, yeah. It's interesting. I've had a personal experience in this arena, and it was incredibly life-changing. And I don't know if, when I haven't gone through menopause, but anyway, I had a hysterectomy. I had a hysterectomy because I had a really bad endometriosis and problems down there. And so I had a hysterectomy, and I still have my ovaries, so I have yet to go through menopause. So it's like I don't want to relate, but I guess I should tell you the story. But, just that decision to remove or have my uterus that grew my babies be removed was incredibly emotional for me and was very difficult for me to come to terms with. I can only imagine when you're starting to go through these life changes that also has a similar thing. It's like, okay, great, now I'm getting old, right? Now I can't have babies if I want to anymore. And it's kind of a weird psychological change. And I think it's a blessing. I think that we have a lot of wisdom as we age and we go through processes like this, and I think we grow a lot. I've grown a lot since then, been able to focus on me. There's been a lot of positive that has come out of that, not to mention feeling better. But, I think that when you're just handed a script, like you're not validated for being vulnerable, or the doctor isn't understanding what you're going through or not showing understanding, it's really tough, right? Yeah. So, most women tell me that they feel like they're always in a fog. That they feel anxious, that they worry, that they don't sleep well, that they become almost obsessive compulsive over things that maybe they weren't before. A lot of anxiety, and they know it's not reasonable. I hear that all the time, right? Well, the treatment for anxiety in the conventional world is benzodiazepines. So then you walk in and you get like a Lexapro and, Xanax, and it's like, bye, take care, enjoy menopause, right? And menopause could last for years. This could be 10 years, could be a year. Could be 10 years. We don't know. Every woman's different, right? So to me, that's not a long-standing prescription, right? You guys with me? So most commonly prescribed, antidepressant, estrogen, and calcium, and a referral to a therapist. Those are the most common things prescribed when you go to your primary care with symptoms of menopause. You're lucky if you get labs, okay? Particularly if you're younger. Most of the time they don't assume that's what's going on, right? My friend's was sudden, out of the blue, way young, way abnormal, right? She couldn't even figure out what it was. They didn't even check it, right? It took a while. So I'm sure that if you're going through this or a loved one is going through this, you have researched it online ad nauseum, right? You've read about the symptoms, you've read about the therapies, you've read it, but the problem is the online research is all identical. If you look at the major health sites, they all say exactly the same thing. And unless you fall into that category, this hasn't been much help to you, right? So I want to talk to you about the large majority of women who are going through menopause in an individualized state who don't fall into the category of, my menstrual cycle stopped exactly after 1 year. This is exactly how it progressed, because most of us, it doesn't progress that way. And the reason it doesn't is because we're under much more stress. We have a much different lifestyle than we did 50 years ago. If you compare menopause now to the woman now to what the woman was 50 years ago, it's different. We're in our 50s now, working, running companies, managing families, handling our social life. Like, we're vibrant and full. We're not sitting at home, right? It's different. And we have different sets of lifestyle consequences to think about, right? So I have no doubt that you guys probably know the general symptoms of menopause, especially those that might be going through it. No doubt. We're going to mention them quickly, but we're going to talk more about why they happen. Because when you figure out why your symptom is happening, then you know what treatment is specific to you. Your symptoms do not always happen simply because your estrogen is dropping. Your estrogen isn't always dropping during the earlier parts of menopause. Important thing to know, right? Because if your estrogen is not dropping and someone gives you estrogen, you're going to feel worse. So these are the things we have to look at, right? Never had it checked, nor did a doctor suggest. Interesting. Sometimes if you've already gone through it, you haven't had your period for a year, you go to your doctor, sometimes they don't check it unless you're interested in using hormone therapy, right? But during the process of when you're going through it, it feels pretty crazy. So let's talk about it. I do have another live I'm going to do on perimenopause. So for those of you that are not quite there, I am going to come back and talk about that in a different live, but we'll touch on it a little bit here. You essentially are labeled, right? You're either perimenopausal, which means before menopause. You're menopausal, which means you're going through menopause, or you're postmenopausal, which means you've gone through menopause, okay? But those diagnoses have long ranges of time. So it's really hard to tell the difference between perimenopause and menopause. So they put these definitions, okay? So of how to diagnose what your diagnosis is, okay? And here's the criteria. And it's really rather silly because I rarely see it go this way, but let's just throw it out there. So the criteria, which I'm sure most of you have read about, is your FSH, which is a signal from the brain, will be elevated, I believe above 25, if I remember. And you've officially not had a period for a year. Now, any of you that are going through menopause or have gone through menopause know that often you'll have a period, then you won't for a couple months, then you'll have another one, then you won't for a couple months, and then you'll have them in a row, and then you'll have one without, and then you'll go 6 months without, and then you'll get one. So the process of getting through a whole year without one could take 5 years, right? So what are you at that time? Are you perimenopausal? Are you menopausal? Do you do anything at that time? Do you just wait it out? What do we do, right? We don't just wake up without a period. Now, for those of you that's happened, where you literally just wake up and you're menopausal and you didn't have any symptoms, kudos to you, man, because you exist too. And I hope that's the way I go. With the stress of my life and how busy I keep myself, I don't think it will, but we try, we hope for that. But the majority of the women don't have it happen that quickly, right? Women, yeah. Most women experience menopause between ages 45 and 50. I think the full range is 45 to 55. Could be as young as in your mid-30s, could be as late as in your 70s, okay? There's no set rule. Certain things can trigger it. Certain things cannot. It could just be a natural process. It could be fast or it could be slow, right? So having only one therapy doesn't make any sense. Some people have a total hysterectomy in their 20s or their 30s due to problems, right? Or a complete hysterectomy where their ovaries are gone. They go into menopause earlier, right? So younger and younger, women younger and younger are dealing with menopause, just as we're younger and younger starting periods. I mean, when I was a kid, I think the average girl started her period at 12 or 13, and now I think the average age is 8, right? So it makes sense that our menopause will start coming earlier as well, right? 8. Wow. Right? It's crazy. All right. So let's talk about some of those symptoms that I know you've Googled ad nauseum. Hot flashes, insomnia, anxiety, depression, brain fog, right? Oh, it's normal. There's nothing you can do about it, right? Baloney. There is. There's absolutely. But here's the other things I see that maybe you don't see Googled, but I see this regularly. I do think the anxiety and depression is a very important point. Because I don't think it's necessarily a true anxiety or depression in a psychological sense. I think it's a shift in hormones, right? That's just uncontrollable. And that's why it's hard to manage. But extreme irritability, lack of interest in sex, and not only sex, but just in your loved ones, like just being intimate in other ways, emotionally. A lot of people lack that want to be with their loved ones. Digestion difficulties, yeah, weight gain, thyroid irregularities, poor stress response, okay? All of these symptoms can be related and they can all be due to something else. So if you don't do the investigation, you won't find the right treatment. And what I find happening is the minute that we get an elevated FSH, doctors are injecting you with hormones, putting pellets in you, and they're not necessarily looking at the whole process going on, and that can cause more harm than good. Or they're not even offering a hormone option, right? I have a question, why? Why on what? I was in a rant, so I'm not sure what you mean. Verify the question, I'll be happy to answer why. Okay, so we need to talk about this. In order to come up with a treatment, you have to look at the individualized woman, okay? So, you guys following me? Men, are you doing all right? Funny, Fred. Most of you know someone who's going through this. Or if you don't, once your loved one goes through it, have a little patience. It feels freaking weird. I can only imagine, you know? I haven't gone through it yet, but I mean, I have tons of women patients. I've talked to so many women about their experience, and it's just frustrating, you know? Kids 8 and 12, why earlier? You know, I think a lot of the reasons periods are starting earlier, a couple things, the obesity concerns in children, more fat mass means more estrogen production. Our diets. A lot of our foods have hormones in them. A lot of our meats are injected with hormones. So what's happening is the hormones are going up earlier in women. So that's why I think a lot of it has to do with body mass. And it's unfortunate, you know, but they're developing sooner because they have more body mass. So estrogen likes to store in fat. So the heavier you are, you tend to have more estrogen typically, on average. Not everybody, but I mean, I tend to find that as a general rule, I guess. You're welcome. Happy to answer. All right, so let's talk about what I see most commonly in this database of women that don't follow the traditional wake up and go through menopause, okay? Usually I see progesterone taper off first. Now this gives you a little bit of a hormone lesson. Now maybe the men can relate to this one because it also plays a role with testosterone and such too. And men have estrogen too, by the way. So we need to talk more about prostate health and estrogen dominance in men here soon. So I promise I'll come back to you. But if you think of hormones like this, if you have estrogen here and progesterone here, they're supposed to kind of interplay with each other, okay? Now keep in mind, they are hormones. And I've told you numerous times that the endocrine system and the GI system, they're kind of all intertwined, right? So if you have a shift in one hormone, you're likely going to have a shift in the other. So we've got the sex hormones that are trying to stay in balance: estrogen, progesterone, and testosterone. All of those come from, for the most part, DHEA, which comes from the adrenal gland, which makes cortisol. So you have to also check DHEA and cortisol. Are those moving, right? Those have an impact on your thyroid, as well as hormones have an impact on your thyroid, as well as the thyroid has an impact on your hormones. So you've got the thyroid levels you got to check too, and you got to make sure those are level, okay? And then you've got the blood sugar aspect of it, which is the last part of endocrine, which is the blood sugar management. So there's these 4 basic disciplines of endocrinology, right? You've got the blood sugar management, you've got the thyroid, you've got the adrenal glands, and you've got the hormones. So when one is shifting, all the others are going to shift as well. So when someone comes to me and they say, well, I'm having hot flashes, right? And they automatically assume that they have low estrogen, or their doctor automatically assumed that they had lower estrogen. It's not always the case, guys. The hot flashes could come from adrenal fatigue, thyroid irregularities, low progesterone, low testosterone, high estrogen, right? All we need, even blood sugar changes can cause hot flashes, right? So if something's out of balance, you have to look at it all and you have to figure out where the imbalance is. So let me tell you what I find most commonly in these situations, okay? Not always the case though. I have to look at all. So I never make an assessment on a woman's hormones or even a men's until I've looked at all of those different aspects and paid attention to if they're leveling out or not, okay? So if your doctor has not done that, if all they're checking is an FSH and LH and maybe an estradiol, we cannot say with 100% certainty that your symptom is due to an actual lack of estrogen. We just can't. And if you're being told that and then being offered estrogen therapy, but nobody's checked anything, you could actually cause more harm than good. Erin, I'm going to talk about evening primrose. Bear with me. So what I tend to find in most women is that their progesterone drops first. And the reason why, and this is my opinion from what I'm seeing, is that as women, we're busier, we're under more stress, we're handling more things. And I think it's awesome. But I think it also has an impact on our health. You know, I'm not going to stop it. I'm still going to do 1,000 things. I'm still going to push myself to the max. I'm still going to be an entrepreneurial woman because that's who I am and I'm proud of who I am. But I do have to realize that if I'm constantly taxing my adrenal glands and I'm not taking care of myself and I'm not giving myself times of rest, that's going to ultimately cause the body to want more cortisol. When the body wants more cortisol, it can pull that from progesterone. So women that have been under chronic stress, have a lot of stress going on, what happens is their progesterone starts to drop a little bit during the luteal phase. So they're typically, what you'll see first is you'll see the periods actually getting shorter, like they're coming more regularly, or they're heavier. And you'll see that in earlier signs of this menopausal process because the progesterone's getting lower, okay? But with that, they could have lack of sleep, hot flashes, anxiety, bloating, weight gain, hair loss. I mean, the symptoms are vast, okay? So what happens is a lot of the time you go to a doctor and they say, oh, well, let's put you on estrogen. I think you're going through menopause. Well, if you do that, what happens? Then you get more of an imbalance between estrogen and progesterone. So what will that do to your thyroid? What will that do to your adrenal glands? What will that do to your blood sugar? Just think about that. So if you make an imbalance more so in an endocrine system, and this goes for any of these conditions. I mean, this applies to diabetes, this applies to hypothyroidism, this applies to adrenal fatigue, this applies to menopause. Anytime you make that gap bigger, you risk impacting another area of the endocrine system because it just wants to keep it level. Does that make sense? So you really have to investigate before you use hormones, okay? Any doctors out there watching that do bioidenticals, I hope this is how you do it, because if you don't, you can cause more problems. So I'm not one to quick to prescribe hormones unless I see an actual trend where I can identify exactly where the problem is. And any of you out there that are patients that have seen me know that. You know, you'll come in saying, no, but I want estrogen. And I'm like, no, you don't. I'm not giving it to you because I can't. Because this is why, but I can do this instead. And I think what happens is a lot of doctors say no, but they don't give you an alternative. They don't explain why they're saying no. I had someone in Facebook that said, yeah, they weren't even offered estrogen. And you might have been offered estrogen because it wasn't appropriate, but maybe they didn't explain that, right? They should explain that, right? Wouldn't it help? So you wouldn't feel so crazy. Because I know we feel crazy sometimes, okay? Us women, we do. Our hormones get out of whack, and I have something in my kitchen that says, I'm sorry for what I said when I was hangry. Because when my blood sugar drops, I'm an absolute bear to work with. Like, I am no fun. My husband can attest to that. And when I was pregnant, he would carry glucose tablets around with him because the minute I would start to get snippy, he'd just basically throw one in my mouth. And it took about 3 minutes and I was back to normal. You know, when stuff moves around, we don't feel good. Okay, and this applies to any area of the endocrine system. So this happens with menopause. So what I usually find is the progesterone drops first, and then it'll be followed by a slow drop of estrogen and progesterone. The problem is there's multiple estrogens, so what'll happen is estradiol may drop, but estrone may stay in the fat cells. I do tend to find that in people that have more fat mass, they tend to store more estrogen. That stored estrogen can feed back and become a problem on the thyroid. So there's a lot of overlap here. So I guess my point with this is make sure that your doctor is not simply looking at FSH and LH. Make sure they're looking at estradiol, estrone, progesterone at the right time in the cycle, I'll tell you that in a second. Bear with me. Total and free testosterone. Thyroid. If you want to know what thyroid labs to run, it's in my thyroid article at drpingle.com. And DHEA and cortisol and blood sugar, okay? Make sure we know what's going on, okay? Birth control. I see someone was put on a birth control pill. There are concerns with the birth control pill over the age of 40. There are risks. Sometimes you take that risk. Many times you don't. But there are definite risks. Cardiovascular risks, blood clot risks, documented, you know? I mean, we spend a lot of time right now talking about a virus that has blood clot risk, right? And I don't know the exact percentage, but it's fairly low. I think it's like 1% of those infected, if not less, end up with that sequelae at this point. Birth control is much higher than that. I mean, it's a lot. It's a pretty significant risk of blood clot, particularly if you're a smoker. So those are things to pay attention to, right? And that's a reason why a lot of women don't want to do them or don't want to do hormone therapy. And that's a right. And I mean, you should be able to choose what do you want to do, right? Maybe educated on it. So at some point, your estrogen will start to drop, okay? And when estrogen does drop, it poses more health risks. Cardiovascular disease, osteoporosis, changes in cholesterol, higher risk of heart disease. These changes do tend to be higher in women that smoke or women that are overweight. Okay, and we do have at 60% of America, and this is men and women, but 60% of America are overweight or obese. Okay? Makes sense? So lack of progesterone can cause insomnia, anxiety, sadness, abdominal bloating, poor stress response, and the lack of testosterone. You may find less muscle tone, and this would be true in men as well, but less muscle tone, less libido. Or not as strong as a libido. If your DHEA is dropping, which does happen over time, you also have a lot of fatigue. Okay, feel tired, don't want to wake up and do anything in the morning, lack of motivation. And all of these have impacts on other parts of the body. They all have impacts on your nutrition as well and the needs of your nutrition. So things change. You have to be looking at the body holistically when you go through menopause. Stress causes a problem. And we're all under stress, okay? And then on top of that, when the hormones do drop, that adds an internal stress. So we've got our external stress over here, all the stuff that we continue to do, which is beautiful and wonderful, but we have to recognize. And then we've got the internal stress of when the hormones are changing and how that has an impact as well. So we are, in general, and this is for men and women, our society right now is a society of adrenal fatigue, okay? And if we don't pay attention to it, and we don't start treating patients and asking our doctors to treat us as individuals and our medicine treating us as individuals, we're not going to get there. We have to be, this is individualized medicine. Everyone is different and everyone is impacted different. And therefore the treatments need to be different. Okay. So I'm not going to go into a ton on adrenal fatigue today. I know I talk about that a lot. I will continue to talk about it. But when you have an overlapping adrenal fatigue with menopause, what I hear women tell me the most is that they feel unstable. They feel psychotic, like they're mentally not okay, but they are. It just feels that way. There's a lack of control. It's like a feeling of, I don't know why I'm acting this way. Many of you husbands, maybe your wife has turned to you and said, I don't know why I'm screaming at you. I don't understand. I don't get it. I just came out of nowhere. I'm so sorry, and they're not lying. It does. It causes this insanity almost. And I can tell you as a woman, and I've had that not with menopause, but with other hormonal stuff I've dealt with throughout my life, it makes you really feel like a failure when you're blowing up at somebody that you love and you don't know why. And then you recognize what you just said and you're like, oh my God, what am I doing? And then you feel like, oh, I'm being a horrible wife. How could I do that to him? Do you women relate? It's hard. And I've gone through that in non-menopause times. Gosh, poor Tyler, when I actually go through menopause. Luckily I try to recognize it and I try to acknowledge it. But, how many of you women can relate to that? Any of you? You find yourself doing that? Men, I'm sure, even if you have a menstruating wife, you've seen these fluctuations. And there's times where she just seems crazy, right? And trust me, she feels that way. And she doesn't have much control over it at times. And it's really difficult. I've had men going through andropause where they're, thanks, Kathy. Kathy says, just wait. Great. I've had men going through menopause or through andropause that go through a very similar experience. They get grumpy, they get depressed, they don't know why, they feel off. Any men experience that? These are hormone shifts, and when you're under more stress, that's a problem. And it's my pleasure. Happy to have this discussion. I know I'm going through moods and know where it's coming from, but I still act abnormally. Yeah, right? And then you're like, oh, God, what am I doing? It's like you almost snap out of it and you're like, oh my God, I was really mean, you know? So here's my advice for the loved ones out there. If your wife starts freaking out, or even vice versa, if your husband starts kind of freaking out and then afterwards apologizes and says, I don't know where that came from, have a little bit of empathy, okay? Because it's weird, okay? So let's talk about treatment. As I said, most of the time, if you go to a primary care, and I've heard this from numerous people, they're offered a birth control pill or some sort of synthetic estrogen, if even offered that, plus calcium for your bones, plus some sort of, if you're having emotional symptoms, some sort of antidepressant or therapy. Now, we've talked about calcium a lot and how calcium by itself does not do anything for your bones. In fact, calcium by itself can cause more problems, like deposition in the arteries, causing atherosclerosis and cardiovascular disease, which is already an increased risk when you go through menopause. We've also talked about how it can deposit in joints, can deposit in the breasts. It has to be balanced. Vitamin D, vitamin K, magnesium, strontium, boron, manganese, all these things that are important for our bones. Calcium by itself, particularly as calcium carbonate, which is the majority of the supplements out there, is not going to do much for you. And that's the first thing that needs to change in that office visit. Let's talk about osteoporosis risks for real. And let's talk about how the bones are built and what do we need to do for that. So we're going to have to come back and talk about that later because I'm on my soapbox. I'm going to get off that, okay? But it's crazy. Calcium by itself doesn't work. But hormones, should you take estrogen? Should you not? I don't know, because it depends on your individual situation. So let's talk about the difference of estrogen though for a second, because most of the time you're offered a synthetic estrogen, right? A prescription, you know, one you get from the pharmacy. So we've got that versus we've got the bioidentical hormones arena where the hormones are custom compounded for you, right? Now there's still risks in both if you use them inappropriately, okay? There are very documented risks with synthetic estrogens and increased risks of blood clots, cardiovascular disease, stroke. Those are huge risks, okay? I don't use synthetic estrogen that often. I don't use bioidentical estrogen a whole ton either unless I've confirmed that the body, you know, doesn't have risk factors for it. But when I do, I'm using things that are bioidentical, estradiol and estriol primarily compounded. Now, I usually start with progesterone. Progesterone does have pretty minimal risk. There are some instances in people with severe endometriosis, adenomyosis, where giving bioidentical progesterone can raise estrogen receptors. So there is a little bit of a balance there as well. My point is, this is an individualized decision. This is a decision that needs to be discussed between you and your doctor in full so that you can make an educated decision. Okay? The women that I've talked to that have gone through this in earlier parts of their menopause have not been able to have these discussions with their doctor, and it left them at a loss. What do I do? Do I do hormones or do I not? Right? So bioidentical hormones is not a one-size-fits-all therapy, which I like, okay? Because the traditional HRT, you've got one dose or two doses and you get whatever one fits in your box, where bioidentical is customized. So I do think if you're working with a doctor that has a lot of experience with bioidentical hormones, often you can really find a nice balance. I have numerous patients that do great on bioidentical therapy in all ranges of ages, from 40s through 70s. And they do great, and their levels are great, and we monitor their levels, okay? You do not start hormones and then not check your levels, okay? If you haven't had your hormones checked in a while and you're on hormone therapy, time to get to the doctor. Natural remedies. All right, so Couple things before I go into the natural remedies. I get asked about these all the time. I had one already about evening primrose oil. We've got black cohosh, we've got red clover, we've got wild yam, we've got ginseng, magnesium, B vitamins, all these things that play into natural remedies in menopause. And I'm going to touch on them and I'll talk about the research. I won't go much longer. I guess we're getting over time. But there's 3 things I want you all to remember when you're going through deciding what you're going to do about your personal menopause process, okay? 3 things. Listen up. Number 1, identify all of the hormone imbalances at play. Thyroid, blood sugar, all of the hormones, adrenals. Identify them all. Find the problem. Find the biggest imbalance, okay? Number 2, keep your entire health picture in mind, okay? Gather information on potential hormone therapy and risks, also considering herbs, nutrition, lifestyle, medications. Gather it all so that you can make an educated decision on what you want to do and feel good about it. If you're being offered a treatment and you have not had an opportunity to research it and look at all the options, you're not going to know what to do. And that's going to add to the anxiety and the distress that you already feel. You have to feel well educated, right? For those of you that have gone through this, do you agree? Be educated, okay? Find the imbalances, be educated. Take your time with it. It's not going anywhere. The menopause isn't going anywhere. You can take a couple weeks to research it before you make a decision, okay? Number 3, and I would say this is one of the most important things. Remember, okay, that this is a huge transition. And this is a normal, natural transition. It will level out. It will pass. You will be okay, all right? The key is to find the best way to manage the symptoms to get you through it. Women have been going through this forever, okay? We all make it, okay, through menopause, right? So go easy on yourself, okay? It's not easy. No one expects it to be easy. As women these days, we expect to do everything perfect. We like to put on this face that we're super women and that we can handle all this and that we can get it all done and that we're never upset. And we're normal, we're human, we're all going through this and it's hard, okay? It is very difficult, the demands that we put on ourselves right now as people in general and definitely as women. A lot of the advances that we've made are awesome, but it also has an impact on our health. So be real with yourself, be honest with yourself. It's okay to realize that this is hard, okay? But also recognize that there's no need to dwell on it. We can get through it together, okay? Cool. I see a bunch of questions. Let me answer those in a bit, okay? I want to make sure I get through here. You're saying bioidentical hormone, you liked it, but insurance doesn't cover. Right, there's no profit in it because it's individualized medicine. Just keep that in mind. Insurance wants standardized medicine. Insurance want everyone to have the same thing. And if you veer from that, it won't be covered. I mean, I was just talking about vitamin D the other day. My patients can't get vitamin D covered on their insurance because they don't already have a deficiency. Well, how am I going to find a deficiency if I can't run it? Through the insurance, right? So insurance wants standardized care. They want everyone to have the same thing, right? That's not what this is. We are individualized people, and the more we're under stress, the more stress impacts our body, the more need we need for individualized medicine. So sometimes you will have to pay out of pocket for that, but you'll go to the doctor less. So overall, your output will be less, right? So let's talk about black cohosh. You guys heard of black cohosh? A lot of people take black cohosh. Clinically, I haven't seen a huge benefit with it, I'll be honest, in the majority of the women. I think because a lot of the times I see that progesterone imbalance and it doesn't do a lot for that. Sometimes in later parts of life, I've had women who have gone through breast cancer, have gone through tamoxifen, blocking hormones with tamoxifen, and I've seen them have some pretty good results with black cohosh. It's been very individualized. But there are a lot of studies on this, right? And it has been shown to reverse or to reduce hot flashes and improve quality of life among menopausal women in research. It is predicted that black cohosh can stimulate estrogen, but also relieve symptoms by activating the serotonin pathway. So when I learned about black cohosh in medical school, I learned it as a modulator, meaning that it can help kind of raise and lower estrogen as needed, but it does have impact on the serotonin pathway. And you will find that often antidepressants, maybe it won't be needed for the mood, but maybe needed to lower hot flashes. You'll see that sometimes. There are other therapies you can use, though, natural, to raise serotonin levels, like there's a lot of amino acids. B vitamins do a great job at that as well. Number 2, red clover. Red clover is used typically for people with low estrogen levels. So if you're one of those people with low progesterone, but you have high estrogen, red clover is probably not going to do a lot for you. So make sure you know where you're at. But it has been shown to lessen severity of hot flashes. It's been helped with other sorts of menopausal symptoms as well. They're still researching red clover quite a bit. Wild yam. I use wild yam quite a bit, and I'll tell you why. Because wild yam can help with the production of progesterone. And most of the time in the earlier stages when you start to feel unstable, and if you do a lot, it's the progesterone dropping. So I find that wild yam can sometimes bring that progesterone up a little bit, which can really help. Okay. Same with Vitex. That's an herb, chase tree berry. I've used chase tree berry quite a bit for that as well, particularly in younger women where the ovaries are still functioning, but the progesterone's going down. So those are two that to look into and speak with your doctor if you think you might be in that scenario. Wild yam has also been found helpful in combating osteoarthritis, which is great. And it's often the base of a lot of the bioidentical creams. Okay? Evening primrose oil can be great. It's basically using an essential fatty acid, which can help with so many different things. There's been a lot of research on it in regards to PMS, symptoms of menopause, women's health in general. Typically, they found that taking 500 milligram capsules over the course of 6 weeks, they found that it lowered, after regular use of about 4 to 6 months, that it lowered hot flashes. So it does take quite a bit of time to work. Other ones you can read about in the article: ginseng, magnesium. I do a whole live on magnesium. Magnesium is a common deficiency in those going through perimenopause. B vitamins, huge deficiency in women going through menopause, okay? So pay attention to your nutrition, pay attention to B vitamins. In fact, quite a few studies that if women have lower levels of B vitamins, they have higher risk of osteoporosis, higher risk of fracture risk. B vitamins are very much involved in the maintenance of hormones. So when you're going through those changes where things are kind of going like this, magnesium and B vitamins can really help. Talk to your doctor about that, okay? I went a little long today, sorry. I do have an article on this at drpingle.com, okay, on 7 natural remedies for menopause relief. What I want you to walk away with, and thank you for mentioning men there. Men, I want you to understand that the women are trying, okay? It's hard. Like, have a little sympathy, work with us. We'll get there, right? And then you're going to go through your side of this too, and we're going to be supportive of you, right? Number 2, what I want you to walk away with is that every woman is completely different. Do not put yourself in one box. The research out there goes to one box. So if you're not finding the answers you need from the standard therapy, seek out someone who will take the time to look at everything and come up with a customized plan for you. You will get through this, okay? It will be okay, right? All right. I have a bunch of questions over on Facebook. One about drinking milk. I never recommend drinking cow's milk, menopause or otherwise, ever. I know. Why? Why, Dr. Pingle? Read through some of my articles and I'll do a live on milk for you. I think I got the rest of them. All of you, thank you for all of you saying thank you. You are very welcome. I'm happy to talk about this type of thing. It's hard to go through. Instagram, I think I got all the birth control suggests for women trying to get pregnant. Depends on your age. I mean, most of the time when you come off birth control, usually you recycle pretty quickly. But then again, if you have things like polycystic ovarian syndrome, you have imbalances in your hormones, you need to look at that. The one thing that I always recommend for women who are trying to get pregnant is methylated folate, not folic acid. Okay? Methylated folate. If you don't know what I'm talking about, you haven't heard of MTHFR, you don't know about methylated folate, go through my lives. Find it. Find the article on it. Read about it. But for the most part, depending on age, usually women will bounce back. But I mean, once again, it's individualized. Okay? There was another birth control. Maybe it was yours earlier. I saw it earlier. I think it was the same question. Yeah, okay. Good. Herbs. I don't necessarily suggest a lot of herbs for trying to get pregnant, just because as soon as you get pregnant, you have to stop a lot of them. But depending on the situation, if we need to rebalance hormones, I may recommend certain herbs. Typically, I use Vitex a lot. So talk to your doctor about that. See a naturopath about that if that's something that's of concern. If you're having trouble getting pregnant, always see a naturopath first. That's my advice. And take methylated folate. So, all right, guys, you've been great. To the men out there, thanks for hanging with me. Thank you. I promise I'll do more men topics. And for you women out there, take care of yourselves. Go do something this weekend for you. I know I am going to. I'm going to sign off. I'm going to go play with the kids. I'm going to call it a weekend. So much love to all of you. For those of you new here, I'm Dr. Tricia Pingle. This is your morning checkup. If this was helpful, share it. Get it out there because there's absolutely no good information about menopause. So share it, okay? Share it with the women in your life. Like it, share it, visit drpingle.com, sign up for the email list. Love having you guys here. Have a great day now. Take care.